I'm Greg Grunberg, and I'm on the road to capture the stories of amazing families living with rare epilepsy. These are stories of love, perseverance, and hope. Today, my son is living well with epilepsy, but I know firsthand what it's like to be a caregiver to a child with a rare seizure disorder. These families have been through the unthinkable, and they're here to talk about it, laugh about it, hug about it. And I'm here to take care of them. This is The Caregiver.
It's time for the big reveal. My guest today is Leslie, whose daughter lives with TSC. Leslie's passionate about painting, and believe it or not, so am I. So, for Leslie's special day of care, we're going to experience the healing power of art. Come on, let's get started.
Do you consider yourself a stylish person? Because I do. Second, I was like, she's got style.
Yeah, I do. I had a grandmother that was
Stylish?
stylish.
Wow.
Look at that.
Wow.
This is really cool.
Oh, hi. Welcome. Hi, I'm Beth.
Beth, I'm Greg.
Hi, nice to meet you.
I'm Leslie. Nice
Hi,
to meet you.
Nice to meet you. I am a licensed mental health counselor and an art therapist. Today, we're going to have Greg and Leslie come in and do a little bit of an art therapy warm-up. They're going to have some fun playing with media and materials, just relaxing into the space a little bit. And then we're going to move into some painting. Feeling ready?
Yeah,
Hey.
let's get dirty.
All right.
Come on in.
All right.
All right. What do we do here, Beth?
This is not about creating a work of fine art that we're going to hang on a museum wall. It's really meant to be fun and not a stressful experience at all.
Do you think we overparent? I mean, we don't. We're we're old parents now. But
We're old parents.
I think we overparent our first. Kelley was your first, right?
Yes.
So when did you know that, Kelley had seizures, or when did you begin your journey as a caregiver?
Besides being a parent, because you're a parent and it's a lifetime. A friend of mine said it's 18 years of hard labor with no parole.
That's so true.
But she had her first seizure at 4 weeks. So then we just started on the journey of doctor's appointments, which I think, it's like this never-ending thing. And she developed these white spots on her, like hypopigmentation. 98% of kids with tuberous sclerosis have hypopigmentation. And he said, this is what it is. So now we have a diagnosis.
Okay.
She's 2 months old.
Did you know anything about TSC
Never
at
heard
that
it.
time?
Oh, never heard. To this day, I say tuberous sclerosis. People say, oh, your daughter has tuberculosis. And
Right.
I'm like, no. I started reading, and everything I'm reading says she should be dead by the age of 20.
How terrified were you by the research you were doing?
I mean, you're just kind of overwhelmed. And because we didn't know what caused it. And we didn't know why. Mike and I took the opportunity to say, okay, this is what we know. We're her parents, just gonna move forward and live our lives. And we did. You manage in the moment. And my advice to parents is don't go down the slippery slope of the what ifs.
So let's cut now to when she's much older. How and what led you to Epidiolex?
Her cocktail of other medications wasn't working. We still had seizures, and it was getting worse. There was a Saturday where I was literally driving to the emergency department because she couldn't stop. Her physician, he goes, okay, we need to talk about Epidiolex. I can get you in the clinical trial. I am willing to put Kelley in a clinical trial because 1, they need information. 2, she's complex and hard to treat.
And how long did it take before you knew that Epidiolex was working?
I knew in the 3rd day, because she's always had nocturnal seizures.
Yeah.
She'd wake up in the middle of the night and then she'd come up and go into her cluster.
Right.
And she didn't wake up. And that was the first sign that Epidiolex had worked.
And now she's got a fighting chance.
Well, she has a fighting chance, but she also is connecting with people. People saw so much more that Kelley had to offer because the benefits of fewer seizures.
But with benefits, there are risks. Were you concerned about any possible risks like increased liver enzymes?
The one that I was concerned for her to handle was loose stool. But we adjusted and it normalized. That was really all that we experienced.
I have to say, mine is amazing.
Mine's just a mishmash.
That's not a mishmash. That's so cool.
Well, it's just different. You're expecting it to be perfect and you have to embrace that it's not.
I find it really interesting because we're both caregivers is we want to be perfect. We want to do it the right way. There is no right way.
There's no handbook.
And same is true with art. So it's like hearing you say, I want it to be perfect, that's exactly what I was thinking of. But who cares? As long as it works for you.
Right. At that moment in time.
Right. Kelley's a gift.
She's a
no
gift.
question.
She's a gift.
You're a gift too.
Oh, thank you.
You're amazing.
Thank
you really are.
No.
You may not be the greatest artist in the world, but you're just an amazing caregiver, and I'm learning in this conversation from you. But I want to get into some painting.
Oh, we're changing mediums.
Yes,
Ooh.
I really love this. This was really cool.
Yeah.
But
yours is cool.
this is what I do.
We could sell yours.
I paint. I could sell mine. You could sell yours.
Yeah.
No, you could. Maybe I'll sell
Kelley
this.
will look at it and go.
Okay.
Man, it
wow.
feels so good to see Leslie relax a little. She's such a strong person, and I relate so much to her philosophy. There's no such thing as perfect. No one right way to be a caregiver. Let's keep the good times going. Make sure to catch up with episode 3, where we channel our inner Van Gogh.
Important safety information and indications. What is the most important information I should know about Epidiolex, cannabidiol? Do not take if you are allergic to cannabidiol or any of the ingredients in Epidiolex. Epidiolex may cause liver problems. Your doctor may order blood tests to check your liver before and during Epidiolex treatment. In some cases, Epidiolex treatment may need to be stopped. Call your doctor right away if you start to have any of these signs and symptoms of liver problems during treatment with Epidiolex. Loss of appetite, nausea, vomiting, fever, feeling unwell, unusual tiredness, yellowing of the skin or the whites of the eyes, jaundice, itching, unusual darkening of the urine, right upper stomach area pain or discomfort. Epidiolex may cause you to feel sleepy, which may get better over time. Other medicines, for example clobazam, or alcohol, may increase sleepiness. Do not drive, operate heavy machinery, or do other dangerous activities until you know how Epidiolex affects you. Like other anti-seizure medicines, Epidiolex may cause suicidal thoughts or actions in a very small number of people, about 1 in 500. Call your doctor right away if you have any signs of depression or anxiety, thoughts about suicide or self-harm, feelings of agitation or restlessness, aggression, irritability, or other unusual changes in behavior or mood, especially if they are new, worse, or worry you. Take Epidiolex exactly as your doctor tells you. Do not stop taking Epidiolex without first talking to your doctor. Stopping an anti-seizure medicine suddenly can cause serious problems. What else should I know when taking Epidiolex? The most common side effects of Epidiolex include increase in liver enzymes, sleepiness, decreased appetite, diarrhea, fever, vomiting, feeling very tired and weak, rash, sleep problems, and infections. Epidiolex may affect the way other medicines work, and other medicines may affect how Epidiolex works. Do not start or stop other medicines without talking to your doctor. Tell your doctor about all the medicines you take, including prescription and over-the-counter medicines, vitamins, herbal supplements, and cannabis-based products. What additional information applies to women? If you are pregnant or plan to become pregnant, Epidiolex may harm your unborn baby, and medicines like Epidiolex may be passed into breast milk. You and your doctor will decide if you should take Epidiolex and about the best way to feed your baby while taking Epidiolex. If you become pregnant while taking Epidiolex, discuss registering with the Epidiolex Pregnancy Surveillance Program, 855-272-7158, or EpidiolexPregnancyStudy.com, and the North American Anti-Epileptic Drug Pregnancy Registry, 888-233-2334, or AEDPregnancyRegistry.org. The purpose of these registries is to collect information about the safety of anti-seizure medicines during pregnancy. What is Epidiolex cannabidiol? Epidiolex is a prescription medicine that is used to treat seizures associated with Lennox-Gastaut syndrome, Dravet syndrome, or tuberous sclerosis complex in patients 1 year of age and older. It is not known if Epidiolex is safe and effective in children under 1 year of age. Please read the Epidiolex medication guide and instructions for use for additional important information. You are encouraged to report side effects of prescription drugs to the FDA. Visit www.fda.gov/medwatch or call 1-800-FDA-1088. You may also contact Jazz Pharmaceuticals at 1-800-520-5568.